know that, especially in mild case, using the asphericity law, sometimes you can have a reshaping of the cornea without flattening. And the last one, the preoperative keratometric values not always can predict the postoperative result. This is probably related to the corneal biomechanics. Well, indications. The ring is indicated for treatment of corneal irregularities, and the main indication is for keratoconus treatment. Moreover, for PMD, for the ectasis, and even for with a refractive surgery. Contraindications. We should not implant the ring in patients with very advanced keratoconus, with curvatures over 60 diopters and significant opacity and scarring, hydropsis, very thin corneas, and pain in patients with intense atopia. These patients tend to rub their eyes, and this could lead to ring migration. Well, there is a continuous evolution of the Ferrara ring nomogram. As the knowledge has evolved, the nomogram has evolved also. So, in the first generation of the nomogram, we considered just the keratoconus grade. So, this showed to be very not a good nomogram, and then we changed to a second generation of the nomogram until 2006 that was based on the spherical equivalent. But if you consider here an eye with minus 10 diopters of myopia and this eye with minus 10 diopters of myopia, we can see that this myopia is axial. So these are not, these eyes are completely different, and the behavior is completely different. So if you implant a ring here based on the spherical equivalent, you should have corneal hypercorrection. So that's the reason this nomogram was no longer used, and we passed to the third generation of the nomogram that was based on the topographic astigmatism. But we know that these two eyes, these two corneas, have 5 diopters of corneal astigmatism. And are these the same? Obviously not. They have the same topographic astigmatism, but the cornea are completely different, and there are different changes after the ring implantation. So that's the reason we moved forward to a new nomogram based on the sphericity that is related to the shape of the cornea. As I told before, the normal cornea is mild prolate, and we would have a target of minus 0.23 as our goal value of cornea sphericity after the ring implantation. Today, we know that the sphericity is the best parameter for the ring selection. There is a tendency to implant less tissue to achieve the same or better correction than was achieved in the past. Moreover, we know that the corneal sphericity can be related to the quality of vision. This is a very